Well, hi, everyone. I'm Daniel Williams, Senior Editor at MGMA, host of the MGMA Podcast Network. We're back today spotlighting one of our 2025 MGMA Award winners. Today, we're going to be talking with the recipient of the Legislative Liaison of the Year Award. And our guest today is Jon Ewing. Jon is a Chief Operating Officer at the Women's Clinic in Jackson, Tennessee, and the current Tennessee MGMA Legislative Liaison. Jon's been a driving force in connecting national and state policy priorities with the day-to-day realities of medical group administration. Jon, we've been talking offline. I just want to welcome you to the show.
Thank you, Daniel. It's an honor to be here, and I'm still kind of in shock that I'm being interviewed for this award.
Well, that was my first question. I wanted to ask you a little bit about that. Where were you when you found out? What was that like? Were you expecting it? Did you know you'd even been nominated?
I had no idea I had been nominated. I got a call from MGMA National from Nifty, and I asked her when she told me this, I said, is this a hoax or someone pranking me? She said, no, you were selected as the National Legislative Liaison. And I said, well, I didn't even know I had been nominated within my state. So it was very shocking. And then I reached out to my board, which as the Legislative Liaison in Tennessee, I serve on a board of executives for our Tennessee MGMA. And I said, are you guys getting me back for the multitude of pranks that I said, surely there are people much more qualified than me to receive an award like this. This is very honorable, and it was flattering and completely took me off guard.
Right. Well, we want to congratulate you again for that honor, and that is amazing. We're going to dig deep into that, what the legislative role is. The last few years, I've had the opportunity to talk to past legislative liaison award winners and really understanding that role a lot, because I think a lot of our MGMA members aren't aware of that. So we're going to dig deeper there. But first, let's talk a little bit about your background. You and I were having fun talking offline about that Jackson, Tennessee area. I was trying to locate it on the map in my mind because I was telling you an older brother of mine, his first job out of college, about 40 years ago, was at the Jackson Sun, the local newspaper there. He worked there for a few years. You brought me up to speed. Tell me about the Jackson Sun. It's not a physical copy anymore. Is that right? Is it? What's the deal with the Sun?
I think they have a few prints still, Daniel, and that's great that your brother worked for them. The Jackson Sun was one of our main sources of advertisement. I have been with the Women's Clinic here for 18 years. So obviously, just 18 years ago, that was a key way that we advertise, that we love to have articles about our clinic or our physicians or healthcare in there. But the Jackson Sun's still online, and people do go and look at it, and they are still one of the great media sources here in Jackson. It's an old building. 10 years ago, I might not have taken someone to the downtown area to show off Jackson, but they've really, as they do with many cities, have restored our downtown. And we had a series of tornadoes come through a few years ago, and it required that we had to clean up the downtown and fix buildings. And it is truly a historical area down there. And the Jackson Sun is in one of those historical buildings and has been for years. But it's a beautiful area. And part of the area they do out of the Jackson Sun location, you can go and have events and have at night you can go and rent the space because it's so pretty, and have different events with your business.
That's incredible. All right. So a little bit more about your background. Are you a native of Jackson? Where'd you grow up?
Yeah, I'm not an original native. I guess you could say I am now because I've been here for over 25 years, but I'm originally from Arkansas. I grew up in a small town called Heber Springs, Arkansas. It's about 60 miles north of Little Rock, and it's just about 3 hours from Memphis. So Memphis, Tennessee. So it's a little lake community with a river that comes out of it. And one of our claim to fame in Heber Springs, Arkansas, is we have the world record brown trout. So there's world class trout fishing in Arkansas there. And I actually was a trout fishing guide through high school and college. And I would take people out on little trout fishing expeditions, and went to college at Harding University, which is a private school there in Arkansas. And I have a biology degree, a Bachelor of Science in Biology. And I went the healthcare route through biology. So that's a little bit of the undergraduate part of my background. And then I moved to Tennessee because I got a job in healthcare.
Okay. I love that. Thank you. And if I have need any fishing tips, I will call you up, because as a kid, a couple of times we went on canoeing trips up there in that northern sort of Arkansas area, and did some whitewater canoeing there. And that was just incredible. It's such beautiful country up there. Really love that.
Well, all of that northern part of Arkansas is the Ozark Mountains. And so if you canoed, it would have been on the Buffalo, the Spring River, Mulberry. Little Red was the one I grew up on. And so perhaps, Daniel, sometime in our future, I plan to go back there one day and again take people out on fishing trips. I still go a couple times a year and go see if the trout are still biting.
That is wonderful. I love that background, because we know that everybody that I have on the show is in healthcare in one capacity or another, but you're also a human being, Jon. So we love to hear a little bit about what makes you tick. So let's talk about where the focus came. You had the biology background, then you got into the practice work. Where did you slide into the legislative side of it? When did that bug bite you, so to speak?
Yeah, so I'll give you just a little bit more on that too. I grew up at that small town in Arkansas. My father was a small town general practice physician, and I worked in his clinic when I was in high school, and that's what we did. I mean, back then people would pay the physician with barter and trade sometimes because they didn't have insurance, and it's rural Arkansas. That's the way it worked. And then I went to college and got my biology degree, and I started looking at different jobs in biology. And what ended up happening and how I got into this is I got into a consulting role working in healthcare administration with a company that was actually based where you are, Daniel, in Denver, Colorado. And we partnered with hospitals. This company was called Metadyne, and they partner with hospitals all across the nation. And I actually landed this job with my BS in biology right out of school, and they hired college graduates to work in management. And so the goal is in the service industries of healthcare, they would work with environmental services, infection control. They would work with patient satisfaction. And so I got into healthcare administration that way, was in Jackson, Tennessee at the hospital here, and then transferred, because it's kind of like the military with Metadyne. You transferred to promote. So I moved to Tupelo, Mississippi with North Mississippi Medical Center, and I was 25 years old and moved up as the assistant director there. And then the director in Jackson asked me to come back and so then I became a director of a department in the hospital and really worked my way up in administration. And then became a consultant to where, as a VP, I traveled. I had a University of Kentucky hospital in Lexington. I had two in New Orleans, Ochsner and West Jefferson. Then I had Cox Healthcare in Springfield, Missouri. And I went in and consulted with these hospitals. So I did that job for probably 13 years. And then the physicians of the women's clinic, who I knew, said, "Would you like to get off the road and be our administrator? We're looking for a new administrator." And I kind of wanted to get off the road. I was flying on Fridays or on Sundays and not getting in till Fridays and seeing time with the kids. So long story short, I've been in clinic administration for the past 18 years here as the chief operating officer. And about 3 years ago, I became, as kind of, I call it a side hustle, the executive director of an independent physicians alliance, which is about 25 clinics here in Jackson and surrounding areas. So I'm also overseeing that. And I was going to the local, or the Tennessee MGMAs, and another administrator who happened to be on the board said, "We'd love for you to be our legislative liaison." So it was a voluntold situation, Daniel,
Yeah.
where I got into the role and then learned all about it after.
Okay.
So that's where the legislation began. I've always had some interest with civics, but I really learned everything from Misty Hickman, who was my mentor, that was the legislative liaison before me. And really, what's fortunate in the state MGMAs as well as the national is there's a great mentoring program where she trained me with what you need to do and how you need to carry this out. And really, you learn through doing. And I absolutely love the role. I've been in it for 2.5 years now, almost 3 years. And I really love learning about what's going on with legislature. So I feel like I'm just covering too much. Why don't you ask me more questions? But that's kind of the background of how I got into it.
I love that. No, we're fellow Southerners. We're storytellers. We, the road may wind this way or it may wind that way. So we'll get back to the truth and the story at some point.
Well, so far it's all true.
That's good. Well, we were talking about fishing tales, so those can get stretched.
I can't tell you that the last fish didn't get a little bigger every time I tell that story.
That's for sure. So let's talk about that. So you were voluntold, so to speak, to get into this legislative side of it. What has surprised you about immersing yourself on the legislative side of things? When we talk politics, everybody immediately has an opinion, but now somebody who is really involved in policy, or at least observing and hoping to shape it in one way or another, what has surprised you about it, or not surprised you about it?
Well, I think that's a great question. And I'll tell you why I love that you asked that question is because when I got into this role, Misty told me we really have to be neutral and bipartisan. We're very careful about our positions. And of course, as a human being, I have positions that I feel personally. However, during this 3 years, I've been extremely, extremely careful to make sure that the only position that I take is one on the side of healthcare. And so regardless of left, right, whatever people's views are, and that was probably the most interesting, people are very quick to give you the way they feel about something in this role. And not that you are kind of a double-minded man or double-minded woman, but it's more of you hear what people have to say, and then you try to make sure that how you articulate that back to the lawmakers is you stay very conscientious and neutral, only to push forward with your, I guess, as kind of being the protagonist for healthcare improvements. And so you have to kind of filter that out to determine what's best for healthcare and what we're trying to push. But you really become a lobbyist. And I guess to answer your question, what was most shocking is I didn't realize how many people are so passionate about wanting to make a difference, and how many lawmakers, and I don't mean this insulting at all, but how many lawmakers don't understand the healthcare side of what we endure empathetically, because they're just seeing it from the side of the lawmaker and not always. When you have a lawmaker that sometimes there is a symbiotic relationship between the lawmaker and the healthcare worker because they've been in healthcare. When that happens, you've got a true advocate working for you in healthcare. And when that happens, that's when we really try to make a difference. But most of the time, the most shocking part is that you're having to enlighten or awaken the lawmakers to what's happening out here in healthcare today.
Yeah, I'm so glad that that's the answer you gave, because about 15 years ago, I was working in the financial services industry in the media side of it. I ran a magazine that covered that. So I learned that the organization had kind of mobilized, and they were going to DC, and they had set up appointments with Congress people from each state. And so I embedded myself there with that group. And so they knocked on doors of Congress people and then had a little bit of time assigned, but it goes exactly to what you're talking about. And it's quite remarkable, actually. This isn't to make a political statement thing, but when you actually observe it, it's remarkable that anything ever gets done, because I'll tell you, the day we had about 20 minutes or so scheduled. Before us was, I'm not joking with you, a Boy Scouts association. There was another one that was a association, I believe it was of nuns. I'm not even making these up. And then we were the financial services industry. And then there were 4 more different industries. And so when we got in the room, and I'm there with pen and paper taking notes, the people who were, pushing their agenda, so to speak, they didn't meet with the congressperson. They met with an intern or someone of that level who was about 22 or 3, right out of college. He had no idea what they were saying. And that may be something that at least at some point you've observed as well, where you are really educating them on the very basics of your topic, at least trying to bring them up to speed. And then you're competing with the Boy Scouts and the nuns and everybody else. So I wanted to share that story because yours may be a little bit more advanced because y'all are entrenched a little bit. But what is it as far as, if any of that resonated or it sounded like a tall tale, I promise it's all true. But what is it, your experience been? Have you gone to DC or are you going to Nashville? Where are you going when you talk to someone who's in Congress or someone of that ilk?
Well, I'll go directly to what in Tennessee, our legislature is called the General Assembly. And I've been to DC, but I didn't go to DC to lobby. But specifically, we go, and I say we meaning as the Legislative Liaison for MGMA in Tennessee, I also serve on the Tennessee Medical Association. And so what's interesting about that is typically it's a group of doctors that the Tennessee Medical Association is asked to work, and they serve as lobbyists and delegates to talk to congressmen and women in Tennessee. And then even on the federal level, we need to. But we'll have MGMA members that are on the administrative side. And the doctors will use us as reference points to talk about the business side of things, to talk about reimbursement. So fortunately, one of our responsibilities and one of mine as the legislative liaison is to go to what's called in the General Assembly for Tennessee in Nashville, Doc on the Hill. So I don't know if that happens in every state or something similar. I'm a little naive to that with what happens in other states. But I can tell you that entire day, the state senators and state house men and women are listening to healthcare people talk about healthcare matters. So that day, they're focused on what are the healthcare topics that are current. And it doesn't mean that we'll actually attend part of the assembly. So we may go to the Senate and hear something they're debating, and it may have nothing to do with healthcare for the day. But when the congressmen and women are in their offices, they have interviews scheduled with those of us to talk about that. And so fortunately, I'm not in there competing with the Boy Scouts or I did see a group of, and this is correlate with your story, I did see a group of people trying to help with improving the roads in Tennessee.
Yeah.
They were pushing that day. But it was interesting because I can recall one representative that I talked to, and we were talking in my business, which is women's health. We were talking about the reimbursement for delivery of a baby. And in Tennessee, we've got TennCare, which is the Medicaid version of that's what we call it, TennCare. And this is not meant to be discriminatory with what pay is, but it's pitiful what the provider gets paid with TennCare. And I was, without having collusion, I was explaining to the congressman that what we get paid on the commercial side versus what we get paid with the Medicaid side in Tennessee, with many times a higher risk for the baby, for the mother. It was terrible. And he had no idea that there was such a disparaging difference between what the payment was. So that was an opportunity to help a congressman to be able to hear empathetically what's going on. And I said, and then I've got to recruit physicians into my practice to come deliver babies that are going to happen. It's going to happen regardless. And they've got to want to come do this in the state of Tennessee. And this is a little bit bigger, Daniel, but what I don't want is someone to get their training in Tennessee, their medical license, and because we've got this TennCare or the reimbursement that they want to evolve and migrate to another state. I want to keep the Tennessee doctors here. But because of that, maybe an obstetrician, gynecologist goes to another state because they need to have, an adequate reimbursement with where they go. That's one small snippet of things that we do with being an advocate out there, a lobbyist for trying to make a difference in healthcare.
Right. And to reiterate what you just said, you were educating that congressperson.
Right.
They had no idea, right? Is that the understanding that they didn't know that?
Yeah, we told them we don't look at what the provider isn't looking at the insurance of the patient that's in front of them. But it's only right that everybody deserves to have some good health care. And if you're having a baby born, pay the doctor for doing their work.
Right.
So
right.
There's a huge difference between what the best commercial pay may be for a delivery, and the way that works, Daniel, is all of the prenatal care doesn't get paid until the delivery happens. So 20 visits you may have in your doctor's office, it all comes when the baby's born is when you get paid. So you've got to wait that time to do that, and sometimes the amount that you're paid barely covers the cost of the nurses that were attending the doctors. So that's just a snippet of things that we're talking about in current legislation to try to make a difference.
Yeah, and I'm so glad you were able to give that particular example, because there is an education that takes place. And because let's be real, I was at a conference yesterday, and it was there was a research study that was done on the level of trust consumers have with different industries. Healthcare actually is pretty high up there. Congress is the lowest. It's last. And they're an easy target to bash and all of this. But then when you meet with someone face to face and you understand what they're, taking politics out of it completely, but when you see what they're faced with in being educated on different topics, when they're being, different lobbyists are pushing different agendas to them, you go, wow. I mean, I do have some sympathy there for what they have to deal with. And then from your side of it, as that legislative liaison, you see the task in front of you in educating them as well. So
yeah, I'm glad you said that. In one of the things that I know that you guys had mentioned for me to bring up was, how do you educate the rest of MGMA members or other administrators on how to talk about this? And what I said is, you start with a common interest with your legislatures. And it can start with your local, your mayor, your people that may be running for state Congress or the U.S. Congress or Senate. And you start having a conversation with those people. And what's interesting is that if you go in with an approach that's angry and dogmatic, it's regardless of your psychology background, somebody's going to shut you off. So that's not the approach for a legislative liaison. You go in and find common ground. And once you get an empathy where both of you are understanding, then push your agenda some with, this is why we're trying to make a difference. Because you can imagine when you're talking about the Boy Scouts, when you're talking about road work that needs to happen, when you're talking about a convent that's trying to be improved, whatever it may be. And then let's throw in healthcare on top of that. This congressman or woman is getting hit from every angle, and, their head nodding. But when you make a difference is when you get in touch with them with something that, like, this is going to affect you and your family. Your mother, your father, your wife, your husband, your child. And we all need health care. And so that's why when you can get that touch, I was looking at some research, Daniel, that in the year 20, let's see, and by 2030, we're going to be 40,000 physicians short in the United States. 40,000. And this is not to be a sensationalist. It's just that's the reality based on actuaries extrapolating that. Our baby boomers, which is our largest population, will all of them will be in Medicare age by 2030. Everybody. So that's going to go from 68 million people that are in Medicare to 80 million people that are in Medicare. And part of my job is to know a little something about the big, beautiful bill, to know a little something on the national level, to know what's happening on the state levels and how that's affecting that. What are we going to do about Medicare finances in the future? How are we going to handle that? What's that going to mean for the 40,000 physicians we're going to be short and a greater population of people? Because the older we are, the more sick we get. And we've got to take care of these folks. And we've got to think about that. And so those are the things that we hit to talk about is like, don't just look at balancing a budget today. Think about what I call it a chess game. In checkers, you think you're just a few moves out. In chess, you're thinking 5 or 6 moves out and you're trying to think about what they're doing. I need people to think about chess moves for 2040, 2050. Let's make a better world.
Yeah. In that statement, you explained to me why I'm so bad at chess. I'm doing the move that I'm doing. So I'm supposed to be thinking 5 or 6 moves ahead. Well, thank you, Jon, for explaining that
Well,
to me.
it's a lot more complex than that. And there's much more people much smarter than I that are really good at chess.
Well, in the remaining time that we have, talk about you and the role that you've had as a legislative liaison. What role are you? Well, let's break it down this way. Are you interacting with other legislative liaisons from other states and or our government affairs team in D.C.? Where are you getting some of the information that you have so you can be better prepared to then present that to your legislators?
Well, kudos to MGMA National. I mean, there are video conferences that I attend, and at the end of those, we have questions. One of the ones that we had recently, and this is something that I carry back to the other, we call them local chapter legislative liaisons, and I typically get the best audience with them on the state level when we typically have 2 conferences a year, and one's in the spring, one's in the fall. And then I get to talk to those other legislative liaisons. But for the national one, MGMA is really good about telling us what's happening out there, communicating that. For instance, they ask over 100 of us to say, how many of you in your practices are using extra man hours for prior authorizations? And they immediately popped up from just that question with 100 people that we were 90%. All of us said that we were using extra man hours we'd never used before with sitting on hold trying to get a prior authorization, which happens to be a huge topic in Tennessee government as well as in national government. So back to your question, the video conferences, I go to local chapters. Many of my peers will ask me to speak through a video conference or to come to one of their local chapters. I made a PowerPoint, which was, I tried to not sound like I was insulting anyone. I said, we're going back to a civics lesson, and you had the little bill cartoon guy that goes through. And so we watched how the bill works, and then we talked about how you can make a difference with that. So a lot of it are side conversations at the conferences where you're having dinner and you're talking about the matters that are affecting these practices and physicians. And others are video conferences, attending in person local chapters and doing presentations with what's happening. When I first started, I was a neophyte and very naive about what was happening out there. Now I can communicate about what others tell me too that are happening in their areas.
Yeah. Last question. for anybody that's listening, they might be at that stage where you were several years ago, like, gosh, I don't know about being a legislative liaison. I don't know if that's right for me, but you've done it now and you've really made it on that personal level. So if you want to share with our listeners how it's affected you on a personal level by being someone who is enacting change, getting in front of people, talk about that.
Yeah, thanks, Daniel. And I definitely want to be an advocate of encouraging others. I had a professor tell me one time that leaders create leaders, and that is kind of the ethos that we try to live by. And so I feel even with this interview today is challenging people that don't be afraid and don't cower away from the word legislature, that even if you've not had any government experience, the government appointed people or voted in people they want people that are real, that can tell them true stories that are happening out there. So make a difference because you're passionate, not because you have a stereotypical want to be part of politics. Go to make a difference with helping healthcare. Play the chess game of looking forward into the future, hearing from other people, and then being essentially what we are, Daniel, is we're being advocates for other people. Within your clinics, you're an advocate for the patient, you're an advocate for your providers. Well, in this role, you're an advocate for improvement in healthcare. And so that's my greatest challenge to anyone else is don't shy away from it. Learn from others, mentor someone else. If you've been a legislative liaison, to someone has a little dabble of interest, let them run with it, because the heart of a volunteer, it's not like we get paid anything for this. We do it because we love to make a difference in a profession that we're passionate about.
All right. Well, Jon Ewing, thank you for making a difference as a legislative liaison and MGMA's Legislative Liaison of the Year. Thank you so much.
Still can't believe that. Thank you, Daniel, for taking the time to interview, and it was nice to hear a little of your background. What's your brother doing now, by the way?
He is a lawyer. He's a corporate lawyer, so that's where he's gravitated to.
Well, thanks for taking the time to do this, and I hope that through this avenue with National MGMA that someone else will realize that you can make a difference out there and try to do that.
Absolutely. Well, Jon Ewing, thank you so much. And for anybody listening, Jon will, along with me, we'll be in Orlando for the Leaders Conference, and we hope to see y'all there. It's going to be September 28th through October 1st in Orlando. Go to mgma.com/leaders where you can learn more and you can register today. Thank you all so much.